Greetings, everyone. Thank you for watching my videos. If this is your first time on my channel, I just want to give a little overview of myself and my medical issues. I am 8 months and 1 week post-op from pudendal nerve decompression surgery. It is a rare and controversial surgery that involves clearing away scar tissue from the pudendal nerve, which is the main nerve in the pelvis. The pudendal nerve is responsible for the pelvic floor function, bladder and bowel control, and people with pudendal neuralgia have stabbing, shooting, burning, numbness in the distribution of either the entire nerve or one of its branches. I've been dealing with horrendous pelvic pain for the past 7 years, and the onset of my symptoms was pretty sudden. And for the past 7 years, I've been pretty hyper focused on treating the nerve pain, involving going to physical therapy, changing my diet, doing standing desks, doing stretching exercises, chiropractic, acupuncture, having numerous tests to rule any and all other things out, including gastrointestinal, functional medicine, rheumatology, you name it, I've tried it. I've also tried an array of medications over the past 7 years. Some of them reduce my symptoms by maybe 20 to 30%, but overall not worth it for me. The biggest game changer I've had is being in pelvic floor physical therapy for on and off for 7 years at 2 different facilities. I've learned a hell of a lot of information, including just things to have ruled out that most doctors don't conventionally test for. And the pelvic floor physical therapy facility that I currently go to is pelvic floor based only. And they do not do internal muscular release as their primary modality of treatment. And I have learned a lot over the years, and my most recent adventure, medical adventure, I guess you can say, is going to vascular doctor, interventional radiologist, who I was diagnosed with multiple vascular compression syndromes, one being May-Turner syndrome, which is the left iliac vein that is compressed by the right iliac artery. And I had a 73.5 compression in which they placed a stent in my left common iliac vein. My physical therapist has been feeling this phenomenon go on since 2015, prior to any surgery I had. And then subsequently they also found that I had moderate nutcracker syndrome, which is the left kidney vein being compressed by 2 other blood vessels, in which they call it a nutcracker syndrome. And last but not least, I have pelvic congestion syndrome, which is basically just a fancy way to say that the pelvis has inadequate blood flow, or too much blood pooling, or not enough blood flow. And basically my entire vascular system has have been reset due to this stent. Since the stent placement, I have noticed some changes in my abdominal pain. Overall, it's not as pressure oriented, and it's not as debilitating to the nervous system. However, I still have issues with standing up and feeling faint. I don't have a lot of energy to stand more than 20 minutes at 15-20 minutes at a time without feeling extremely fatigued and faint. I am on blood thinners, and I probably will be on blood thinners probably indefinitely. I'll probably switch doses after 3 months, but I think to some degree I'll have to be on blood thinners indefinitely. The other thing that I've been told by several physical therapists and medical professionals is they believe that I have Ehlers-Danlos syndrome, which is a connective tissue disorder that is genetic. There are 14 different types of EDS, and the most common type, unfortunately, does not have DNA testing. However, the other types do. So I am on the hunt to find a genetic counselor at this point. My physician gave me a reference. There's a new physical therapist at my facility who has EDS and who has told me that I basically look like I have EDS. And while the most common type of EDS is hypermobile EDS, and it's basically a connective tissue spectrum disorder, in which 2017 they kind of revised the diagnostic criteria since there is not a molecular test for hypermobile EDS. It's called the Beighton score, and basically they have you move your fingers and thumb and arms and knees and whatever in different types of ways, and they score basically how if you can or can't do certain movements. And for me personally, I can probably do 50% of what they asked me to do in terms of that test. However, everybody's experience with EDS is very different. It is on a spectrum. You're not going to stereotypically, when people think of somebody with a connective tissue disorder, they think of someone who can do splits or who can be a contortionist or move their body in all types of weird ways. And that's not always how it presents itself. My greatest fear, I think, at this point is getting a diagnosis of hypermobile EDS on paper, because there's no one doctor who you can go to and say they are a specialist in this field unless you travel. There's a couple in the country. It's becoming more prominent. The research is out there. There's a whole website. They're doing studies. The study they have out there now is they want to find 1,000 participants to sequence the entire genome and compare and see which genes can potentially be involved in diagnosing hypermobile EDS as opposed to the other types. And until I have a diagnosis on paper from another doctor, whether it be a rheumatologist or some other doctor that can test for it, I can't participate in the study, which I really want to participate in the study. I think in 2020 they used to have like conferences where they would have like meetups for people to go and congregate, but now since COVID, they're doing remote virtual visits or whatever. So I'm not sure if I can participate in the study, but it would be something that I would like be super interested in doing, especially if it advances the diagnostics for hypermobile EDS. And I strongly believe that I have EDS. I've had so many like moments in the past like month or so, just going over every single symptom I've experienced since childhood and so many different organ systems. And the most like, I guess, thought-provoking thing that I've come across or figured out in the past few weeks is that people with EDS are prone to all types of shit happening to them, such as hernias, prolapses, dislocations. I haven't had any dislocations. Just like gum issues, gastrointestinal issues that I've experienced. There's issues with the hollow organs, such as the uterus and intestines and things like that. In my Facebook groups, in the vascular compression groups, there are so many people that have EDS within those groups. So it makes sense that the internal organs and the blood vessels are hypermobile. It also makes a lot of sense of why some of my PTs get pulled to random ligaments that are holding up my organs, and they're saying that these ligaments have tension, issues with my sacroiliac joints. Basically, I have to relearn an entire new way of life. Like, how do I walk properly? How do I stretch properly? How do I lay down properly? What kind of equipment do I need to exercise with, stretch with, make sure that my joints aren't dislocating or my ligaments aren't stressed out? Like, I basically have to figure this out myself. And thankfully, there's a lot of support groups out there for EDS patients that can potentially help me with this. But I just feel like this would have, if I would have known that this was a thing, um, I I would have, I just can't even imagine, like, I'm hoping for the future that with these tests and everything else, that people don't have to go through what I went through for 7 years, just not knowing why their nerves and blood vessels were acting so foolish. And if I can just help like one other person, um get the help they need before it gets to that point. And since EDS is a genetic disorder, like I'm like 90% sure it came from my mom's side of the family. My maternal grandmother had a bunch of issues that were very puzzling in her life. And um so I'm reaching out to some of my family members on my mom's side to potentially like educate them on this type of thing, because EDS is not something that is going to jump out at you. It's not going to be something that's like in your face, like, oh, I can do splits or whatever. It's not going to be like that for a lot of people, and a lot of people are going to suffer unnecessarily. And so this week has just been a lot of thinking about EDS and thinking about um like what my next moves are in regards to that. And I'm probably going to wait until March to undergo any more procedures to potentially help with some of this pain, whether that be a vascular procedure or a neurological procedure. I'll probably give my body an ample amount of time to heal. So my videos will probably just be updating you guys on research I've been doing, or just people I've been reaching out to. For those of you who've been watching me, I appreciate the support. I appreciate all the direct Facebook messages I've gotten. I've met people. I'm meeting more and more people like me with neurological, vascular, and EDS type of stuff, and every single box fits. Every single thing that I've ever experienced makes so much sense now. I experience a lot of dysautonomia, which is the dysfunction of the autonomic nervous system. So heartbeats, breathing, pelvic floor, urinary, vasculature, everything. So it's all starting to fall into place. However, with that being said, now it's just more fighting with doctors, and I've gotten quite good at it. It's just until it's on paper, I cannot argue with disability people. I need it on paper to prove my case. And that's the hard part about it, cuz in my heart of hearts, I know I'm a zebra. I'm a defective orange and gray zebra, and I am beat down mentally. I am very, very lonely at this point. Um, Trying to work on video chatting more with folks, especially people with pelvic pain and vasculature issues and what have you. But overall, I believe that some of my pain was attributed to May-Turner syndrome, the vasculature, for sure. Is it the end all be all? No, absolutely not. I still have nerve pain. I still have difficulties. I can't see myself driving or wearing certain clothes, or I've had to make a lot of lifestyle changes, and I'm still figuring out what I need to do. I'm terrified to exercise. I'm terrified of bursting a blood vessel or an organ at this point. Just now knowing what I know now and what my body's capable of. I know my musculature I need to strengthen my muscles, because as a result of connective tissue and ligaments being faulty, the muscles tend to overcompensate in people with EDS. So fitness is important, and it's just a matter of how do I protect my connective tissue in the meantime. So again, thank you for listening and watching. And if you guys have any questions, please feel free to direct message me on Facebook, Instagram, Embrace the World in Gray, underscores between each word. I am on Tumblr and Instagram and YouTube. So thank you so much for all the support, and I will talk to you guys in a week.